Welcome to A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP, Fargo Moorhead, where we are adding local color to your airwaves. And tonight on our show, Irregular Response to COVID-19, I will be talking about the difficulties with implementing stay-at-home orders, mask wearing orders, enforcement of parks being closed, enforcement of businesses being closed, fines being levied, CDC responses, companies. What do they do? How do they do it? And how is it done uniformly? In my opinion, I don't think it can be done uniformly. I don't think there's any way that you can get everyone to do things the same exact way. We can't even agree on how we're going to be reopening our states. So this is causing a lot of problems, and I'm going to look at them a little bit more closely, especially what that means locally. And I'm also going to be sharing with you through local examples, through national examples, what we are still facing with regard to this coronavirus. New findings about how the coronavirus affects our bodies, including silent hypoxia as well as blood clotting. Very interesting new developments in how this virus affects us and is killing some people, as well as a local family's case with the COVID. I have an exclusive interview coming up with a local DJ by the name of Oscar Zurita III, who has recently learned, after having been hospitalized for what he thought was a kidney infection, that he is positive for COVID. And now, so is his whole family. 7 people, all quarantining, all have COVID. We'll bring you that exclusive interview coming up right after we thank our viewers and listeners and tell them how they can support our work.
Well, thank you for joining us tonight. It's a beautiful Friday night up here in the Midwest. The weather's changing. It's getting nice outside. We're very excited about that. But hey, we're in our house. You can support us and find us several places. One, you can leave us messages on our message machine. It's a call-in line that basically goes to a machine. You can leave a message about 3 minutes long. It's 701-566-0917. That number is 701-566-0917. You can email me, Duke, at kpppfm.com, and you can email Cindy at kpppfm.com. You can go to our website, kpppfm.com, look around, look at our programming, look at our past shows, check out what we've done for the past, 3-4 years. And also, while you're there, you can support our work by going to kpppfm.com/donate, make a tax-deductible donation to our radio station to help us continue to go forward and continue to produce the media that we're producing today. You can also go to @media_PPP for tweeting us, and go to Duke1517 at YouTube. We're streaming on YouTube and on Facebook tonight.
And of course, pound that like button if you are on our social media. Share this information with other people. One of the things that I said to the gentleman I'm going to be interviewing tonight is that we've been doing shows that give information to the public about the latest in research, in testing, in therapy, all of the information that you need to make the most informed, the best decisions for your family during this crisis. Let's go now to the world numbers.
Mm-hmm.
Currently, in the world, we have over 2,789 cases. It's actually up to 2,790 cases now.
Oh, okay.
90 cases. And we are at 195,920 deaths worldwide.
Wow.
We've tested 4,692,797 people in the United States. And we are over 8,000 dead people in Mexico now.
Oh, wow.
Let's look at the U.S. In the U.S., we currently have 923,612 coronavirus cases, 52,092 deaths.
Wow.
We are over the 50,000 people mark in deaths.
Mm-hmm.
This is truly tragic that this many people have died, and we still don't have a handle on the coronavirus.
Yep, that's true.
93,404 people have recovered. If you look at the states here, you'll see more of those gaps in the red column, which is the new deaths. If you recall, before those columns were full. You even have missing information in the new cases column for states like Massachusetts, where the information is lagging. We don't have up-to-date information. I still have no answers for folks on why that is. It's disconcerting, to say the least. But we have a lot of places that are reopening as of Monday. I don't know who else is anxious about that, but I am. I'm extremely anxious about this.
Anxious meaning what?
Well, I mean, I'm upset about the idea that more people who can't fight this off and will be getting very severely ill, will have to be hospitalized and could die, are going to be exposed to this. And I know folks are saying that those of us who have underlying conditions, like myself, like our friend who's going to be speaking tonight, Oscar, that those folks should just stay home and they'll be fine, and the rest of the people can go to work. But what if those people that are going to work catch the virus and then take it home to someone that's vulnerable?
Yep, exactly.
And the more people that are out and about and congregating in groups where they could catch it, the more likely that somebody that's trying to keep from catching the virus and bringing it home to a vulnerable person is at greater risk of catching it.
Mm-hmm.
It's just it's a matter of looking at the numbers, and that really, really scares me, especially since North Dakota is already making plans to reopen what little businesses they had closed, which includes,
Bars,
salon, bars, all these vectors of illness.
Yeah.
Where are we in our states, North Dakota, Minnesota?
Well, in Minnesota, we have 2,567 confirmed cases, 1,254 recovered, and there's been 160 deaths in Minnesota. For our county, Clay County, we're up to 68 confirmed cases. No new deaths, but there's been 3 deaths in our county, and that's very unfortunate. We're a small county, but over in Fargo, which is a larger part of our community, the cases keep on going up. In North Dakota, there's 644 confirmed cases. 214 have recovered, and there's been 13 deaths. There wasn't a new death, in the past 2 days, there's been one person who passed away. But when it comes to Cass County, there's 274 cases, and that keeps on going up. That's almost half of all the cases in North Dakota. And, so it's like, once again, I feel like I'm complaining about the arrogance of people in North Dakota, because we're right next door in Minnesota, and we've been closed for over a month, and North Dakota hasn't. And people are just driving around, and they're going places, and they just say, hey, well, if you need something, just go to Costco. And I say, no, we aren't going nowhere. We're ordering stuff online. I'm not going to Costco. I'm not going to expose myself to anyone. And the people in North Dakota is like, oh, you can, because we are, and it's that sort of arrogance. And the numbers continue to go up. I'm not sure if North Dakota is going to open up, because they wanted the numbers to level, but they're not leveling. One of the requirements to open up that Doug Bergen put out himself was that they needed to level and start going down.
Look, a lot of things were said about what we were going to do before we started reopening, and it seems like we're not really going to do all of those things, and we're still going to reopen. So, I guess we have to lower our expectations in terms of what how well we will be protected, if we're going to be protected, and we have to, until things get really hairy and Americans have to take more drastic steps, I guess.
Yeah.
We're going to have to leave it up to people to do the right thing and hope that they do the right thing. Although I've shown you that's not really happening. And I have more to add to the story of Simplot, RJ Simplot. In fact, I want you to get that video ready. If you could jump ahead to where we have the interview with the mayor of Grand Forks.
Okay.
While I talk a little bit about my concern with regard to the mayor of Grand Forks, Mayor Brown. And that is, I told you about the potato processor in Grand Forks that said, thanks, but no thanks to mass testing for all their employees. Well, my colleague over at KVOY, Chris Berg, recently interviewed the mayor of Grand Forks to ask him, was the governor talking about you when we said we were going to have our own Smithfield here in North Dakota, referring to the outbreak of COVID-19 in South Dakota's Smithfield meatpacking factory plant? And he was like, nope. And he repeatedly asks the mayor, what is the ramifications? What punishment, what sanctions, what consequences will this factory, this company face for basically lying to the people, to the people overseeing L&M Wind, what's it called? Wind Company? I can't remember. L&M something, Wind Power. About whether or not they were following the CDC guidelines of social distancing and other safety guidelines within the business. And basically, he said they deserve not to be, they're not accountable. They don't deserve to be punished. I think that the fact that when they found cases in their company, they shut it down right away and sent everybody home and started cleaning it shows they're good stewards. They've done a good job. And it is truly breathtaking what hoops this mayor goes through in order to defend a company that, did not want to have oversight. It's very clear to me. But I'll let you listen to the interview and you can tell me what you think.
They put out a piece about the COVID-19 outbreak in Grand Forks at the L&M Wind Power plant, now making it one of the country's hotspots for COVID-19. So what happened and what is Grand Forks going to do about it? Joining us now on our 702 communications line, the mayor of Grand Forks, Mike Brown. Mayor Brown, thanks so much for giving us some time tonight. We really, really appreciate it. I want to start with this, sir. So in this article, it says an email came into your health department with a complaint on the night of March 22nd. So for our audience, on March 22nd, it says they were expressing concerns about the company's indifference to recommendations made by health professionals. You sort of took over this email chain, according to this article, and then you asked Keith Lunn, the president of the Grand Forks Region Economic Development Corporation, to look into it. Why did you have your economic development guy and not your health department person look into this, sir?
So I'll tell you what really happened. We received the email at 8:30 p.m. on Sunday night, and then it was forwarded to the Public Information Office at 8:36. At 8:43, it was forwarded to the mayor's office. At 8:51, it was forwarded from the mayor's office to Public Health. At 8:51 in the evening on Sunday night. So then Monday morning at 6 a.m., the Public Health sent it to the mayor's office. And we also included Keith Lund in this communication about we had this concern of an LM employee who was concerned about physical distancing at his plant. So Keith Lund said, my preference is for me to make the call, because we talked to Public Health and they said the physical distancing or the CDC guidelines or the CDC recommendations apply to private citizens as well as businesses. And so because he had a long-time relationship, LM Wind Power has been in our community for 20 years. They're part of our manufacturing base. Keith Lund said, my preference is for me to handle this myself because he could speak to top management and make sure they got the message. So that is what he did on March 24th, Tuesday. He spoke with the plant manager, and the plant manager then expressed that we are complying with the CDC guidelines. So I did not ask Keith Lund to do it. Out of his character and his commitment to the community, he volunteered to carry this message because he knew it would mean more going to the top.
Okay, so you're a doctor, sir. You're an
Yes, I am.
OBGYN, and let's say there was a pregnant woman that had an issue, and I knew her for a really long time. Would you want me to call her to look into her, or would you want to make that phone call?
I would think if the information is important that she gets to her, and if I'm busy and I can't, and I think it's important you get the information, you can say the words just as well as I can.
Okay, so did Keith Lund actually go to the plant and inspect it, or did he just make a phone call and take their word for it?
I wasn't there, but I assume he made a phone call.
So which goes back to, and I can understand if Keith Lund's got a relationship, you want to do that, but then why not also have your health department go and actually do it? I mean, I think we both can agree, sir, this is a very highly infectious disease, yes?
Yes, we can, and
So
we had
you-
our first case of COVID March 30th.
Okay, so then why not have a health department person go make a physical presence on site to make sure, because it sounds to me like you're just taking their word that they were following the CDC recommendations. Why not
Well,
have,
I trust those people, and I trust our employees and our management at there. But our public health does not go in, we inspect restaurants, yes. We don't inspect workplaces. Workplace safety, I don't think is the forefront for our public health department. They do the testing and
Sure.
follow-up and contact tracing to help us contain this disease. I don't believe their job is to inspect safety for COVID concerns.
sir, would you agree this is an unprecedented situation? So maybe normally not, but if this is I mean, this is the first time ever we've had all 50 states. And
I think this is our first pandemic in 100 years. Yes, sir. Pardon, I didn't mean to speak over you.
no, that's fine. I appreciate
I think this
you
is our
doing it.
first pandemic, and we're learning. Excuse me.
So I guess again, and I don't mean to, we'll move on in a moment. Well, let me frame it this way, okay? Because I'm not a health expert either. You're a doctor. Let me do it this way. So in this article from the Trib, Jim Shothorse, apparently he spent 30 years at the Grand Forks Public Health Department. And here's what he said, sir, so you can refute him. He said, why did the mayor coordinate the early response and not your health department? What would you say to someone like Jim Shothorse with that kind of experience?
Well, what was his job at public health?
I do not know, sir.
He was an inspector, so he inspects. So that's the solution to what his workforce. My understanding is he's an inspector. So that's what he would suggest we inspect. But the public health department is fulfilling their role in helping us manage COVID things. You have to look at, the 16th of March, I declared a public health emergency. The 18th of March, I closed City Hall. And then the 19th of March, the governor made his action. So we were early in this. And you're right, this is our first pandemic. And we are learning from this. And would we have handled things differently? Yes. But I don't think it would change the outcome because this is, like you say, highly contagious and potentially fatal disease. And I think that I appreciate the testing that's going on because that can improve workforce safety. When we find people, we isolate them, we get them out of the workforce. So I think that's very important. But we were early in the phase. He expressed a concern. We carried the concern to management. Management responded to it. And I thought that was our role.
So you just said, hey, could we have done things differently? Yes. What would you have done differently now looking back?
Well, we wouldn't be having this conversation because I would have had public health do it. And then it would have been clean. But we collaborate in this community, and when there's a problem, people step up. And Keith Lund is one of the most respected economic developers in the state. And he said, hey, I have a relationship. Let me carry the message. This is so important.
All right. Let me ask you this, sir. It's a couple things sort of quickly just for time. I'm getting this feedback. I'm not suggesting this, sir, but I'm getting this feedback from people. This is 900 employees, obviously a big revenue stream for the city of Grand Forks. Was that in the back of your mind? Essentially, were you putting economics over health?
No, I'm a pro-life doctor. And so I think life is more important. And I keep telling people, the economy will recover, people won't. So it's so important we put health and safety first. And that's why it's so important all of us follow the CDC guidelines and recommendations, which are evolving. And now we're expected to cover our faces in public.
Okay.
So we must be aware this is a changing environment.
Sir,
And be proactive. Yes, sir.
what are you going to do then? Because it sounds like LM Wind Power Plant lied to Mr. Lund. So what are you going to do to hold the wind power plant accountable?
I have no prove that they weren't complying. So I cannot say that. But what are
Sir,
we doing?
sir, excuse me, Mr. Mayor Brown, excuse me. You've got one of the hottest spots in America right now with the COVID-19 outbreak. So it's pretty clear that something's amiss. So my question to you is, because now that is happening, it's going to obviously impact your health systems up in Grand Forks. It's impacting what's happening in that plant. My question to you, as the mayor, what are you going to do to hold them accountable?
I don't think they need to be accountable. This is a highly contagious disease. They have a manufacturing plant. We have got CDC guidelines we use to minimize the risk, but it's a highly contagious disease. People are in close proximity in a manufacturing plant. And so, we predicted this would be coming from the very beginning, and people said, oh, you're overreacting,
Okay.
and now we're here, which is where we expected to be.
Let me ask it this way then, sir.
Yes, sir.
Mylan Tufte, our Department of Health Director, recently signed an executive order to ensure that these employees from LM are self-quarantined. The governor told me this week that is a local situation, meaning that it's up to the locals to determine how you're going to enforce that executive order. So let's say one of these employees gets caught outside their house. Are you going to hold them accountable, and if so, how?
That's exactly what I said. This is a pandemic is evolving. And now, before, people weren't looking at enforcement or containment other than staying home. And now we depended on people's good judgment to stay home. But right now, our city attorney is drafting language to say, if you do this, we do this. If you go outside, we do that. If you don't comply, you're going to get an ankle bracelet. So this is an evolving thing, and we're dealing with it.
So let me just make sure I'm understanding you correctly. What you're saying to me is, Chris, I'm not going to hold LM Wind Power Plant accountable, but now if I find out that someone breaks the quarantine order, I'm going to put an ankle bracelet on them.
This is an evolving situation because this is our first time of dealing with this. And we see we're going from less strict to more strict as we deal with this. No, I don't hold LM Power or Wind Power accountable. I think that they are good stewards in our community. I think that they work in a manufacturing environment. People are in close proximity. You're going to see spread. And I think they acted very responsibly by closing the plant immediately when they found out there was a problem.
Let me ask you this, sir. You're telling me that you're going to now enforce an executive order signed by the Department of Health Director, which I never voted for Mylan Tufte. I don't think you did either. No. How are you going to usurp my constitutional right for peaceful assembly?
I think sometimes public safety, and that's why this is evolving. Maybe we have to say, hey, we respect your right for public assembly, but not more than 10 people. And we have expectations now. We want people to behave, and these were guidelines, now they're expectations. You go out in the community, I want to...
Okay, and then that's a lot longer than I would normally play of the interview, but I really wanted you to listen to... this guy was all over the place.
Yeah.
With what he was saying is like he wants to put ankle bracelets on employees that violate quarantine, but do nothing to the company. And quite frankly, I think, Chris asked him some very pointed questions about why he sent some dude.
Yeah.
That's somebody that feels like they're more in touch with or
knows
the owners of the company better and would hear it coming from him more than they would from the health and safety director of the city.
Yeah.
What? That doesn't make any sense. And this guy's a gynecologist, so Chris asks him why he would allow somebody not having to do with the health and safety sector to go and have this conversation about the CDC guidelines and the safety of the workers without actually going there physically. And the guy says, I wasn't there, but I assume it was just a phone call. So you assume the guy didn't go there.
Mm-hmm.
You assume that this person that was making the call didn't even go to the plant and check on the safety of the workers, didn't verify whether the CDC guidelines were being followed, and you're okay with that. He asks him in follow-up, okay, I want to just make sure you didn't put money before people. And he says, no, I'm an OBGYN, I'm a pro-life doctor.
Mm-hmm.
And the very next words out of his mouth is, he's not going to pursue doing anything. What are the ramifications for the company? Nothing. They're good stewards. business as usual. This is very problematic,
Oh, yeah.
I think, and it shows you where there are cracks, where people could fall through those cracks, because I mean, this is a very irregular response to a very serious problem.
Definitely, and it's our second mayor in a row. 2 days in a row, he's the second mayor, and the mayors are like really out there, really out there.
I guess it's a good time to have a lawyer for a mayor here in Moorhead.
Yeah,
We got lucky. Hopefully, this guy will be able to interpret what is best. I'm just really surprised that this mayor went so far. Mayor Brown went so far as to say that the priority of the health department isn't worker safety. I mean, it seems to conflict with what our governor in the state of North Dakota is saying about how having testing and worker safety sewn up is going to be the path forward for North Dakota to reopen its economy. And here the mayor of Grand Forks is totally disconnected from that understanding.
Yep.
That was hard. I want to tell you folks that I recently learned that another meat packing plant in Iowa has had an outbreak too. This is a lot of factories, meat packing plants, and one of the things that was brought up by my colleague in this interview that I have been very concerned about, both here in North Dakota and Minnesota, but also all throughout the Midwest and in states like my home state of Iowa, where there is a lot of immigrants working in these factories, and there could be an issue of a language barrier. The plant in West Liberty Foods, that has now found 52 cases. They've sent over 100 people home. Some of them, because they are higher risk, older employees, that they don't want to catch it and then get very ill or die from it. And others because they have symptoms and or have tested positive. This brings me to another question. How are factories and employers making decisions about who gets to go home and quarantine and who doesn't? Because we know that there are asymptomatic people that are spreading this virus. And we also know that we have employers like J.R. Simplot that can just say, thanks, but no thanks, we don't want to do the test. So how do we make sure that our workers are safe when we don't even have some kind of directive from our governor, from our state leaders as to testing across the board and quarantining or isolating folks? I'm going to share with you in a moment the interview with Oscar Zurita. What was the most shocking to me about this local case in Moorhead of COVID is that the folks there in the hospital now know he's tested positive, as well as everyone in his family, and there has been zero follow-up to check on how this family is doing. All of these things, very concerning, not to mention the fact that we still have people protesting these closings of business and states who are not really taking into account the seriousness of what hospital staff are going through. I found this very poignant interview with Chris Cuomo of nursing staff, and I thought I would share it with you because there's something that we still have to think about with regard to this virus as we reopen our economy, and that is the impact that it is having on people who die in the hospital alone. Take a listen.
An ICU nurse, okay? She's working 12-hour shifts. What does she do on her day off? She goes and stands silently against shutdown protesters in Arizona. And we'll show you her there, silently. And remember, this is her day off. She's treating coronavirus patients at a Phoenix hospital. For hours Monday, she stood in silence, protesting along with several of her coworkers, even as some rally goers hurled insults at the healthcare workers who are saving our lives. What a study in contrast. Her name is Lauren Leander. She's the nurse behind the mask, and she joins us now on Prime Time. Thank you so much for taking your precious time to be with us.
You're so welcome. Thank you for giving us a chance to speak.
So you're working, you're killing yourself in there with your coworkers. Where does the idea come from that on my day off, here's what I think we should go do?
You know, we were really inspired by the other viral photos from the healthcare workers in Denver, that were going around the internet. And we just were so impressed by their action and just the power in their silence and what they did. And we said, yes, like that's the kind of action that we can take with something like this. That's what we could do.
What was your message?
You know, my message, being a nurse, is just to speak for the people who can't speak for themselves and to speak for the people in our hospital that are suffering in ways that the general public cannot see. So I'm there as a voice for the homeless and the immunocompromised and the Native American communities, the nursing homes, and just the populations that are just being devastated by this virus right now. And I know those people would be urging the general public to continue to stay home for them.
50,000 people have died. We know there are going to be more. We know it's a lagging indicator. We know all too often men and women like yourself are the difference between what happens. And what do you want the people to know who are protesting, who say, hey, this is my freedom, and you're messing with my freedom, and it's been too long, and you're killing my business, and you're killing my job, and I should make these decisions for myself?
You know, I would just love to be able to take them into the hospital with me and to, put them in a pair of scrubs and to get them to see just the suffering that's going on in the hospital with these COVID patients that are isolated from their families and that are dying alone. I would never wish this on anyone, but if they could just see what it's like for somebody to have to pass away via FaceTime with their family because they're not allowed in the hospital building, it's just the most devastating thing you've ever seen. And, these people are coming out of medically induced comas after they're recovering from COVID and learning that multiple family members of theirs have died since they've been in this medically induced coma. I would just love for these people to be able to see the perspective of my patients, and I'd hope it would change their minds.
And, to be very clear, those FaceTime conversations are often motivated by people like you and your coworkers who...
I wanted folks to hear that part about how people are dying. And I know I've talked to you about that before. I've talked to you about the fact that we're going to have to grieve collectively at some point because we're not allowed to grieve in this moment. And I wanted to just remind people that there isn't going to be some savior that's going to come in the form of a politician or some leader that is going to fix this problem. We have to start thinking for ourselves. We have to fix the problem. We have to be mindful of the people around us, the vulnerable in our community. And to that end, I would like to invite folks that are seeing issues in their community to give us a call. What's our call-in line? 701-566-0917. You can leave us a message there. You can email Duke at kpppfm.com or me at Cindy at kpppfm.com. Is your company social distancing? Yes, Amy, there are occupational health services at plants. I'm wondering how the people that are watching, that are their oversight, that are management, that are bosses at these companies are implementing and checking and investigating if we can have issues like the one I just played for you at a plant here in Grand Forks and what we've been seeing in the last days. If South Dakota can have problems, if Iowa can have problems, this could be happening on a massive scale and we don't know how bad it is. In addition to that, I want to tell you that we are learning about this virus every single day. One of the new findings about this virus is that it causes blood clots. We will share some article links from livescience.com where you can find this information on your own. Check it out. The blood clots are something that they had not thought was going to be an issue killing people. They figured people with lung issues smokers, people with asthma, that those were going to be the people most affected. But what they're finding, and there was a study that came out of the Netherlands with 189 patients, 30% of those people ended up having blood clots serious enough that some people, even young people that had no history of cardiac problems, died of strokes. So you have a bunch of people whose first indication that something is wrong isn't a cough, isn't a fever, isn't shortness of breath. It's a life-threatening stroke.
Wow.
And by the way, we have, since we first learned about this virus and we were told that it's mainly going to affect old people and it's mainly going to affect people with underlying conditions, we have since learned that this is not just a lung issue. It doesn't just affect your lungs, which, by the way, it can scar for life and leave you with problems with being able to breathe for the rest of your life. We've also learned that it can affect your sense of smell and your sense of hearing, which is an indicator that it could affect your nervous system. We've also learned that it can damage major organs like your kidneys, like your liver, like your heart. And what is even more disturbing is that it's causing silent hypoxia. If you do not know what this is, hypoxia is when your blood is not properly oxygenated. Obviously, this is very important because without proper oxygen in your blood, proper levels of oxygen, all functions of your body cease. Your brain doesn't work anymore. Your heart stops. Your organs shut down. You die. Here's the thing. The way that this coronavirus is affecting people, they don't feel shortness of breath. They don't know they have hypoxia, which is why they're calling it a silent killer, silent hypoxia, until they check their oxygen. And they're finding that some people that are going into the hospital are severely, like, they need to intubate that person right now, and that person had no idea they were on death's door, ready to have organ failure at any moment, ready to have their brains and their hearts turn off, because they had no idea what their oxygen level was. Many hospitals are now monitoring people's oxygen level, telling them to monitor their oxygen level with oximeters or sending them home with oximeters so they can check. Unfortunately, not all, and I would probably say not most, of the people being sent home with suspected COVID or with COVID to quarantine are receiving any kind of follow-up or suggestion that would help them understand the kinds of things, the risks they should be looking for in order to go to an emergency room, like the case of Oscar Zurita III. He has had no follow-up. His family has had no follow-up. All he was told was to take Tylenol and stay home for 14 days. In addition to 14 more days if the fever recurred. And we know that the incubation period can be much longer than 14 days in many cases. So here is my interview with Oscar. Hey, Oscar. It's good to see you. How are you holding up?
I'm holding up pretty good.
So I'm really sorry that this happened to you. The first thing I wanted to say to you is that I'm really sorry this has happened to you. I know that it's going to be rough. I saw your post about how things were last night since you found out that you have COVID, and you sounded a little scared in your post.
Yeah, it's a scary situation.
When did you find out? Walk us through, because last week you made a post on your social media that you had to be hospitalized. What happened there?
Well, I woke up with fever and chills, and all of a sudden, like, the first thing came to mind was COVID-19, but they rushed me to the hospital and they said it was a kidney infection.
Did they test you for a kidney infection? I mean, did they test you for COVID when you went to the hospital?
No.
So you didn't have any other symptoms, but other than the fever that might be indicators of COVID. Are you worried that you might have contracted it at the hospital?
I'm not sure because while I was in the hospital, my brother's girlfriend was sick, and when I got out, I started. We all lived together, so like
Right.
when I got out, 4 days later, I started getting symptoms of coughing and body aches. I didn't get no fever all of a sudden. I just started coughing a lot, uncontrollably.
After you got out of the hospital, about 4 days
Yeah,
after.
yeah. And then she went to go get tested because someone at her work tested positive, so they all went to get tested. So then I went to go get tested after she did, and
Do you,
she tested after she got tested positive. And then
do you mind saying where she works, or is that something that you would rather keep confidential?
confidential.
Okay. So there's a one case only at the place where she worked, or were there more than one case?
I think there was just one case.
Okay. And so then what happened? You
No,
found
there was
out.
two cases actually. There was two cases.
So she went and got tested, and she tested positive.
Yeah. And then me and my brother went to go get tested the same day, the following day.
Okay. And how did you get the test? What's that whole process like?
Well, I was supposed to have a procedure done, and I told him I think when I went for my appointment, I told him I was coughing. I told him I think it's allergies, and she's like, well, we need. They took me to a room, and they were like, well, we need to cancel your appointment because you're coughing. And I'm like, okay. So she gave me a piece of paper where to go online and fill out a survey of my symptoms, and then send it to like the nurse. And then they called me the next day and told me to send like they gave me a location to where to go to just go through the drive-through, and then they swab you. They normally swab, they go through your nose, but this time they went through my mouth. So they swabbed my mouth.
So you had one of those tests where they swab your mouth, not the one where they like tickle the back of your brain with the big long swab.
No,
And how
it
fast
was
did you get the results back?
it was 2 days.
Wow. So that was pretty fast. I noticed that you posted your results online, and you were telling people you were positive for COVID. Were you trying to alert folks that you might have come into contact with about that?
Yeah, well, I've been bunkered down since March 27th. I haven't left the house,
Mm-hmm.
so I only been in contact with my family, which everyone tested positive. So
And that's how many people total?
that's seven.
So everybody in your home tested positive. What are the range of ages of people in your home?
Well, my mom's 65. Oh, 67 actually.
Mm-hmm.
She's 67, and my dad's 57, and my sister she's 43,
Mm-hmm.
and my brother's 27. His girlfriend, I don't know how old she is, but I think she's 31.
So you have some young people. Do
Yeah,
do
my niece, she's 11. She's here too. She tested positive also.
and how are their symptoms? How are they doing with the COVID right now?
Well, I'm doing better than most. Right now, my dad's coughing pretty bad, and my mom, her back aches, and she said her kidney aches. I tell her to get moving, and my sister, she's there coughing also. So there, I'm the only one that my cough, it's slowly going away. I'm doing better than yesterday. So
You have a lot of underlying medical problems as a history in throughout your life that you've gone through, which makes you a higher risk for serious problems with this virus. Is there anybody else in your home that also has underlying problems that makes it a bigger concern for you?
my mom,
Your mom, yeah. And how many days have you been going through the COVID now?
um, almost 5 days.
Almost 5 days. Okay. Did you get any indication when you left the doctor's office after you got your positive, after you got your test and you got the positive notification. Did anyone call you? What were the instructions to you in your email with your positive result or from the hospital or the doctor about your treatment for COVID?
The nurse just said to bunker down, to not leave the house for 14 days. If I have fever, just if I keep getting fever, to stay bunkered down for another 14 days and to take Tylenol only. And if I'm having symptoms of not able to breathe or have a fever over 101, to come in to the emergency, and that was it.
Did you get any advice or did your family members get any advice about quarantining together, how you're supposed to go about, keeping yourselves from reinfecting each other or spreading it outside of the community? Any instructions for the rest of the family?
No.
Did they? Well, you said they did ask you about getting them tested, or did they ask you about getting them tested? Did they
They asked
ask
me
you, like, who have you been in contact with since you have COVID?
they just wanted to know who I was in contact with, and I just told them my. Well, I wasn't actually not in contact with my brother's girlfriend at all. I was staying in a separate room from them, so I don't know exactly. It's probably through the air, or I don't know. I'm not sure.
So you didn't have any contact with the girlfriend, your brother's girlfriend, who's tested
But we all
positive.
live together.
What?
We all live together, so
Right, but you actually live in on the downstairs, right?
yeah.
So you really don't share a floor, or do you have a lot of contact with the upstairs floor since you've been positive?
I did have a lot of contact
Okay.
upstairs. Yeah.
Okay, so there's a possibility of contamination or, infection just from being in the same room with the rest of your family members. Uh, how how have you been in terms of support for your family? Because you're all kind of stuck there now. You can't leave. Do you have everything you need? Do you have family members or friends that are stepping up to help you get groceries, medicine, all of that good stuff?
Just family. Just the ones that are living here. My mom.
How are you guys getting your groceries and your supplies that you need for your household?
Well, ever since we tested positive, we haven't left and gotten groceries.
Do you need help, Oscar, or do you need somebody to deliver some food?
Um, I guess I'm not sure.
Well, I'll
I don't know how I'm gonna do it.
I'll DM you. I'm sure that people in this community that are listening to the plight that you and the rest of your family are all in would definitely want to know if you need help and try to make sure that you guys have everything that you need. So I'll message you privately, and you can give me some details I can put out for folks that want to help bring groceries or supplies that you may need, and you can give me a list of what your family's looking for. Okay.
Okay.
One of the things that's really surprising to me is that nobody from the hospital has followed up with you to check how you're doing, how your symptoms are, or to check on your family and make sure that you guys are, improving or that your symptoms aren't getting severe. Was that something that surprised you? What did you think? I mean, I'm sure you had already heard about the COVID because you were worried that you might have symptoms when you first felt sick. So is this how you thought that the response would be for somebody that tests positive?
No,
What did you think that was going to happen?
I don't. I really don't know. It's like they seem like they don't care. It's just like, yeah, if you have it, they don't want nothing to do with you.
They don't want anything to do with you.
That's
Uh,
the way it feel. That's the way I feel. Like, especially when I went in and they like kicked me out right away just because I had a cough. But I did test positive, but still, like, the way they acted, they like. And when I was in the hospital, they don't let nobody in. They just let you, you go in there by yourself. You have nobody could go in with you.
So when you went into the hospital for your kidney infection, you were not, by the way, you were not tested, right? You said you were not tested when you went in for the kidney infection.
No, I was.
And you had a fever and you were afraid that you might have COVID, because I remember you did a video. I've been watching everything on your Facebook. I'm like, well, I was worried about you, man, because you've had a lot of brushes with death. You've been really, really sick in the hospital.
I've had sepsis 8 times.
You've had sepsis 8 times.
Yeah.
You were
I've only got into septic shock 3 times. So.
And you were hospitalized in 2018.
Yeah, with pneumonia.
So you've had problems with pneumonia.
Yeah.
And all of these things were things that the hospital knew when you went in. Did you talk to them about that? You're concerned that you might have COVID?
Yeah, I told them. I told the nurse, "Can I get tested?" It's like, "Oh yeah, you could get tested here." And then, like, all of a sudden, it's just like that was it. And then they didn't test me or nothing. It's just like, I don't know.
So did the nurse that treated you, or the staff that you came into contact with when you were hospitalized that first time, were they wearing the gown, the goggles, or the whole medical gear and all the gloves?
Full medical gear.
Did they have you isolated?
Yeah.
So you didn't actually come into contact with anybody that you think could have been other patients, other visitors? Okay.
No, it was just like the same nurse the whole time. It was 2 nurses actually. It had to be the same nurses over and over again.
So when they didn't test you, what was the reason they gave you for not testing?
I mean, give me no reason. They just, I don't know. She probably forgot. I don't know if she forgot or. I don't know.
Correct me if I'm wrong, because I remember when you posted you were going to the hospital and asked for prayers. I stopped what I was doing and I actually prayed for you, and I thought, please help Oscar right now, because this man is very vulnerable. And when you posted about it and you did your video and you said, "Don't worry, everybody, I don't have COVID, it's just a kidney infection," I thought...
Yeah, because the results came as a kidney infection.
So I thought they told you, "Don't worry, you don't have COVID," because you got tested.
No.
So they didn't test you. You had some symptoms that could have been COVID related, and you asked for a test and you didn't get it.
Yeah.
Well, man, I'm really, really sorry to hear how things have been for you. And I'm going to reach out to you privately so we can find out what you need and see if we can't get people in the community to step up and give you support. What is your recommendation? What do you want people to know about what's happened to you that they don't know? That you, as a person that was worried about the pandemic, were surprised about and want people to know so that they have forewarning?
Anybody who has a cough or feeling just a tad ill with like body aches or anything, just to go get tested right away.
Mm-hmm.
Anybody with a cough, it might feel like allergies or like, I don't know.
You might have symptoms and not even know it.
Yeah.
And the other thing I wanted to ask you is, tell me what it was like for you. What are your symptoms like? I know you had a really rough night last night. Give people details on what it feels like to have this virus.
Your whole body aches. You feel like you feel weak, and it feels like somebody's stabbing you in your back and your lungs. Actually, it feels like it gets sharp pain.
What is it like when you hold your breath? Do you have pain in your lungs?
Well, yeah.
Is it hard to take a big deep breath?
yeah, it just gets sharp pain.
Did they give you in the hospital anything with which to monitor? So you're having trouble breathing, is what I'm getting at here, and it hurts to breathe. Did they give you anything at the hospital to monitor your oxygen levels or tell you how to make sure that your oxygen levels stay at a healthy, rate?
No, they didn't give me nothing or tell me anything about that.
Well, tell me what it's like sleeping at night, because you mentioned in your post that this is something that gets worse at night.
Well, yeah, it feels like the fever comes at night more than the day. I think because in the day I'm more active, but when I'm resting, I feel like the fevers are coming back on, and your back just kills you. Like you gotta sleep on your side or sitting up because it feels like somebody's punching you in your lungs.
During the day, what are you doing? Like, what's your treatment? What's your regimen? Your daily activity?
Um, well, lately I just been walking up and down the stairs, trying to keep active,
Mm-hmm.
and then holding my breath, count to five and holding my breath. I do that about 5 times, just holding my breath in, count to five,
Mm-hmm.
taking
Well,
a deep breath.
I mentioned to you that there's some respiratory therapies that are recommended, and I'm going to send you the video for that after the show so that you can take a look at that and see if it doesn't help. But Oscar, I really appreciate you sharing your story. I hope that you let me check in with you later as the days go on, just to see how you're doing and so that you can update my audience about your condition and the condition of your whole family. Would that be okay?
Yeah, that'd be okay.
Thank you so much for talking to us. Get better soon and let us know how we can help, okay?
Okay,
Thanks, Oscar.
I thank you.
Folks, I've shared Oscar's contact information on Facebook, one of the best ways to get a hold of him right now. If you're in the local area and you would like to drop off some food, any help would be appreciated right now. You could just reach out to them and let them know so you can get their address and drop off location. Every single member of his family is sick, from the 11-year-old to the 67-year-old. Every person is in pain. Every person is down for the count right now. And he was a little shy and embarrassed to say what is obvious, which is nobody can, the help that he has is all of the family members that are sick with him and in quarantine. That's the help he has. So if you can help him in any way, I recommend that he get an oximeter, a pulse oximeter, so that he can measure his blood oxygen and that he have more telemed conference visits or some kind of follow-up from the medical staff. It's shocking and disturbing to me on so many levels. When I started the show, I told you I have a lot of questions. Yeah. I have a lot of concerns about the reopening because so far what we've been doing in businesses and in hospitals in terms of testing, in terms of telling the community who's been tested, who's under quarantine, when they can come out, when it's safe for them to go back to work, and all of these things are so irregular. Our response is irregular from one town to the next, one hospital to the next in the same town. What's it like in the rest of the country? I just can't imagine that when we roll all of this out and we all go back to life as usual, that we're not going to have some major, major hiccups. And the thought that they send you home with COVID and tell you to take Tylenol and don't leave your home and don't even follow up to see, especially with someone that's been hospitalized for pneumonia and has nearly died in the hospital 3 times. You don't follow up and check to see how that person is, and you know that him and everyone in his family has this? it makes me wonder about our response. And we're supposedly not in the middle of a firestorm of cases with an overcrowded hospital and full ICU. What's going to happen when we get to our spike?
Yep.
If the response to people having COVID in our community is like this now, what's it going to be like when we're overwhelmed?
Mm-hmm. Exactly. And all of our medical institutions are in Fargo. There's one clinic, like an outpost clinic here in Moorhead, but all the rest of the hospitals and all the other medical establishments are in Fargo.
Yeah. So, folks, as much as I understand everyone's need to get back to work, I really think we need to iron out some hiccups, some major screw-ups, and some things that I think we just need to be doing a lot better. Having said that, I want folks to enjoy the beautiful springtime weather. Pray for your brothers and sisters in the states hit by tornadoes that are devastated right now. And also, pray for this family here in Moorhead. The entire family has caught this virus. It's very, very frightening because there are several people in Oscar's family that are high risk, and they need our community's help, our community's support to get through this. We need to do a better job of staying in contact with the people that are going through tough times during this pandemic and lift them up and help them. Pray for each other, wash your hands, stay safe, and have a great weekend. I want to share with you some silly, funny, uplifting news before we go. There was a report of a mountain lion in the Edmond area,
which is Oklahoma City.
It turns out it wasn't a mountain lion at all, although it does look like a mountain lion from the picture there.
It was a house cat.
Turned out it was a house cat. I mean, like, can you just imagine all of the people looking out their window? I'm looking at my windows all of the time, constantly. I'm looking at the birds and the rabbits and the squirrels in my yard. I still haven't convinced Duke to make me a squirrel picnic table, but he's too busy for that. But I'm definitely looking out the window, and they're like, "Oh my God, did you see that mountain lion?" Because people are looking for the wild animals now. They've seen so many stories about it. And it was just a really big fat cat. It was just a quarantine cat. You know, somebody's just feeding way too much of the cat food to this quarantine cat. Meanwhile, and many of you are very upset. And I understand, rightfully so, you're very upset about the extreme measures that are taking place in some towns, such as Houston. In the town of Houston, Texas, I reported yesterday that the mayor was being sued by the police for implementing a fine of $1,000 for anyone not wearing a mask. That was incorrect. Sherry, thank you for correcting the record on that. It turns out that the person that they are being sued, the mayor is being sued, but not by the police department. Instead, it's by a GOP activist. And the police union is very upset about it. The head of the police union, the spokesperson, said that they don't want to stop everyone and ask them how old their kids are so they can give them a fine of $1,000 during a pandemic where everyone is unemployed. They don't want to have to throw people in jail. They don't want to have to take, all of these extra measures. Obviously, police don't want to put their lives in jeopardy dealing with things having to do with people protesting, assembling, being out of their homes for various reasons. So, I think that this will bring you a little bit of a smile. This is a video from India where the police are not having it. I don't know what kinds of sticks they're using. They look like they're about an inch wide and pretty thin, but they're literally beating people in the streets with sticks. Have a look. It's just, this one's riding in a motorcycle yelling at people. and just give him a little whack on the bum. Here they got 2 cops whacking him on the bum, and they right away. It's like, this reminds me, do you ever get spanked, Duke?
Yes.
With a belt? And
Yes.
people they stick their hands in the way. They're like, ow, ow, ow. And then you get hit with on the finger. Man,
that
this
really
guy needs
hurt.
this.
Guy can't start his motorcycle. Go home.
And they're like hitting him in the legs. This guy wants to argue. And they're all wearing masks and gloves. They got their protective gear on. But when they see people out on the streets, they are getting a beat down. Look at these 2 guys. They got to run for the hills. They're just driving down the street on their motorcycles. The cops get off. They throw the stick at it from far away. These cops, they're making people do exercises. Look at this. Calisthenics. I don't know how. This could be a little ill-advised if you ask me.
Yeah.
Because this is not social distancing, and now you're okay. Stick your head between your legs and kiss your butt goodbye, because that's exactly the pose that these people have been put into. And then you got the push-ups. I mean, that's a little bit much. I say probably don't have people do a bunch of loud, heavy breathing when you're trying to stop the COVID virus.
Other, yeah.
Just send them home. You know, I think that the stick beating was probably enough. Well, that's it for tonight, folks. Thanks for being with us here on A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You've been listening to 88.1 FM, KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. God bless and good night.